Hello everyone, I'm Dr. Shammai Rockove from the Center for Men's and Women's Urology in Portland, Oregon, answering questions that you've submitted onto our site, and again I appreciate that. We've discussed a lot of things involving female urology in some of the past posts, so I'm going to answer some of your questions on male-related topics. And this came in earlier this week, and I think it brings up some important points. Doc Rock, in the morning my testicles are normal, loose, away from my body. But later on they get close to me, they're almost always firm next to my skin, no looseness. Is this normal? Thanks for letting me ask. Yeah, and these are really essential questions. The testicles normally are very mobile, so there's nothing abnormal about the testicles moving up and down, depending on the weather, for instance, depending on whether or not someone's getting tickled. So normal mobility up and down where the testicle goes right back to its resting position is completely normal. What's not so normal and what is worth asking the question over is what happens when a testicle gets elevated and it doesn't go back to its normal position. Now there are muscles that surround the testicle that bring the testicle up, and they're called cremasteric muscles. They're strongest actually when men are younger. As guys get older, the muscles get weaker and the movement of the testicle goes down. But there are a couple of things to realize in a couple of instances which can be very dangerous. And I was thinking a way of creating a metaphor that wasn't offensive. And this was just an ID badge that I had lying around. But if we picture this as being the testicle sitting within the scrotal sac, it has attached to it a group of tubes which feed it nerves and blood vessels. And they're called the spermatocord, or the cord of the testicle. And normally the situation would be something like this, but there are times, abnormal times, where because of this morphology, because of this setup, the testicle actually can twist on it. We call that testicular torsion. And if we can imagine that there are blood vessels and important feeding vessels within this cord, the twisting cuts them off, almost like having a noose around those areas, and it threatens the blood supply and the nourishment to the testicle. If that is not rapidly resolved, then the testicle can die. So for all men, all boys, any situation at all that makes one concerned that this twisting is occurring is an emergency, and the evaluation should be done in an emergency room, which would have rapid access to a urologic surgeon if necessary. Things to therefore worry about. If you get acute pain in the testicle or in the scrotum, and it doesn't instantly go away, but it certainly continues, you must get to the emergency room. So acute onset of pain without any obvious source, for instance getting hit in it, you must go to the emergency room. If you look down and you see that one testicle is more elevated than its other side, and that this is abnormal for you, and if this is associated with new onset of pain, that's a similar sort of problem, you must go to the emergency room. Those are the signs of testicular torsion. If during the course of the day you notice that your testicles sometimes they sit in a lower position, but both of them sometimes sit in a higher position, they're not at all uncomfortable, there's no pain associated with it, and that when you relax or go into a warmer environment, for instance, wear looser clothes, take a shower, and they easily go down, that's no problem. I guess what I'm trying to say, though, is if you have any question at all that the movement, or I should say lack of movement of your testicles, especially if they're elevated, and especially if there is any sort of discomfort whatsoever, if that's occurring and if it's bothering you, it is much better to get it checked out, because the one thing you don't want to miss out on is the possibility of this testicular torsion. It's something that can be remedied, it's something that can be taken care of, but if testicular torsion occurs and is unchecked, it can lead to irreversible testicular damage. So I hope that responds to the question. I think the take-home message is going to be that's something that you should get checked out. That's best checked out by a urologist, not by a general physician. Again, these are the sorts of things that a general physician may not see many of in an entire career, but a urologist will see quite frequently. Any questions or clarifications needed about that, please send us a message. If not, thank you again for watching these segments. Please keep the questions coming in. I'm Dr. Shammai Rockove from the Center for Men's and Women's Urology.